Good evening and welcome to the second ever webinars for the AMR Animal Health Awareness Week 2021. My name is Damien Barrett and I'm a vet in the Department of Agriculture in the NDCC with responsibility for animal health surveillance. The theme of this evening's webinar is One Health with an emphasis on zoonotic disease. As you're all aware, zoonotic diseases are those animal diseases that are transmissible to man, and this forms a key part of the One Health concept. This evening, Minister Pippa Hackett will join us in a pre-recorded message. She's the Minister of State for Agriculture with responsibility for land use and biodiversity, and she's going to set out the context of this evening's webinar, the importance of zoonotic disease, and the importance of the One Health concept. So, Joe, would you be able to share that recording, please?
Good evening. I'm delighted to launch tonight's webinar on One Health, with an emphasis on zoonotic disease. As you are all aware, zoonotic diseases are those diseases that affect animals, but which may also affect people. So I want to welcome you all here to this webinar on this important topic. This is the second of a series of webinars my department is organising for Animal Health AMR Awareness Week 2021. The concept of One Health is based on the premise that the health of animals, people and the environment they share is linked. Therefore, anything which impacts negatively on the environment will in turn have negative repercussions for the health and well-being of livestock and of people. Within the One Health framework, zoonotic disease assumes a huge importance. Data compiled by the OIE, the World Organization for Animal Health, tells us that 60% of pathogens that cause human diseases originate from domestic animals or wildlife, that 75% of emerging human pathogens are of animal origin, and that 80% of pathogens that are of bioterrorism concern originate in animals. If such pathogens spill over into people, they can affect people much more severely than they affect the original host, as is so dramatically exemplified by COVID-19. The probability of such spillover events occurring increases substantially as forest cover is lost, and wildlife is more likely to come in direct contact with people and domestic animals. And the global economy is now so interconnected that if another pandemic was to emerge from such deforestation in another part of the world, it could be on our shores sooner than we expect. From a food production point of view, the OIE estimates that more than 20% of global animal production losses are linked to animal diseases. Such losses clearly have implications for food supply and food security, but they also have environmental impacts. Livestock with suboptimal health not only produce substantially less than their healthy comrades, they continue to emit as much waste, including greenhouse gases, as their healthy comrades. While there has been a lot of commentary on cattle numbers recently, it's essential that the health of our livestock is optimised to ensure livestock production is as efficient and sustainable and ethical as it possibly can be. To give you an example, an Animal Health Ireland study has shown cattle with a history of fluke infestation were up to 50 kilograms lighter at slaughter than a control group without fluke infestation, while a Scottish study has estimated that such cattle took 50 days longer to finish. Neither scenario is positive for the economic well-being of the farmer or for the good of the environment. Minimising disease in turn will reduce antimicrobial usage, which in turn can reduce antimicrobial resistance, or AMR, which is also a very important One Health objective. This matter has been highlighted in our webinars this year. Reducing and preventing the development and spread of AMR is inextricably linked to the optimising of animal health, and that is why we have developed a joint approach to this Awareness Week. AMR is a key focus in the One Health area because the same antimicrobials are relied upon as effective disease and infection treatments in people also. The recent launch of Ireland's second National Action Plan to address AMR clearly outlines the current and intended actions to promote disease prevention and responsible use of antimicrobials in order to protect human health, animal health and welfare, and also our shared environment. The One Health approach to AMR is holistic, encompassing the role of people, animals and the environment in relation to AMR, and all three sectors should not be viewed in isolation. Clearly, there are multiple benefits to the environment, our domestic animals, our flora and fauna, consumers and to farmers from improving animal health and reducing our reliance on animal health products. As well as linking the health of animals, people and the environment, One Health seeks to encourage collaboration between those professionals working in animal health, livestock production, human medicine, environmentalists and ecologists. And I'm delighted to see such a range of eminent professionals from several backgrounds have been assembled for you this evening to talk to you, and I wish to welcome them and thank them for giving up their time to share their knowledge with us. Our first speaker this evening is Dr. Helen Roberts, who is a Senior Scientific Officer in DEFRA and is responsible for international disease monitoring. Helen also chairs the HARES, or Human Animal Infections and Risk Surveillance Group, and I wish to thank her for inviting staff from my department to participate in that group. Our next speaker is Dr. Margaret O'Sullivan from the HSC in Cork, who is the HSC National Lead on Zoonosis, and she will give us an update on the situation with respect to the zoonoses seen in people in Ireland. Given the role that habitat in the epidemiology of tick-borne diseases, I'm looking forward to hearing more about these diseases from Dr. Annette Zintil from the UCD Veterinary School and what we can do to manage them. Finally, I would like to welcome Ciara Reid, who is to speak on the zoonotic threat from feeding raw meat to dogs. As well as a busy veterinary practitioner, Ciara is the current chair of the Farm Animal Welfare Advisory Council, and I wish to thank her for the work she does for the department in chairing that group. While One Health may seem a vague concept to some, it has a very important role in the sustainability of the planet. It is vital that we ensure that all stakeholders are aware of the importance of One Health and the effects of their actions can have on the environment, animal health and public health. I'm looking forward to this evening's talks and I hope you enjoy them and that you will learn from them. On that note, I'll now hand you over to our Emcee for the evening, Damien Barrett, one of my department's vets, and Damien will get proceedings underway. Thank you.
Thanks very much, Minister. And I think the Minister has really put our evening into context.